Good morning. We'll just take a couple of minutes to test your earphones. Can everyone hear? There is an adjustable on the side. If you think we're too loud, too quiet, you're thinking we're talking rubbish, you can turn us down, okay? So if you just have a couple of minutes making sure that everybody's okay. Thumbs up? Okay. Well, I'm delighted to welcome you to the innovation stage. And you've all been in plenary and heard some of the fabulous work that's going from a policy through to implementation. But the innovation stage is about learning how the knowing and the doing. So Paul talked a lot about taking our insights and taking it out into communities. And what you'll find over the 2 days is exactly that. What's happening across the UK and how they're implementing personalised, proactive, preventative services. What's our challenges? What's our opportunities? And this is the place, the how, in conference. So welcome. So you heard on stage when Paul, over the last 12 months, we've been working in a coalition with lots of partners across the industry, across representative bodies, to form the Tech Action Alliance. And I've got to be frank, at the beginning it felt like herding cats. Everybody had different agendas, everybody wanted something different from our work in the Action Alliance, but I think once you get a chance to read the challenge paper, you'll start to see true challenges in there that need solutions, from tech-enabled care as a body, as a sector, but also the wider sector of that alliance and how we work outside of ourselves with our key partners. Technology-enabled lives. How wonderful if we can start to change that common language away from the physical technology, but like we heard from Rich this morning, how we can make better lives for people living in communities. What would that take for us to shift the dial with our policymakers and government and really start to have a common language and a common way of working to integrate health, housing and social care? I've only got 5 minutes, but I would really like to share. Many of you in the audience will have seen our model, our proactive and preventative care model. Over the last 6 to 8 months, we have lots of special interest groups that take our themes from conference, go and work in the background and come up with magic. So come up with the things and the tools that help you to take what we say at conference in terms of new provision and turn it into reality. So we're launching the proactive and preventative guidance, and there's some knowledge and network sessions where there's commissioners who've actually used this tool to write their specifications and to go through a process to deliver proactive and preventative care. I would like to take the opportunity to thank the people that have took the time. You can see some of our partners that are working in the special interest groups. And over the next couple of days on this innovation stage and the knowledge and network and live on the innovation stage at the end of day 2, we'll be publishing our new work programs for data and integration. This is how you, as our members and the wider sector, get involved with us as a sector and our wider opportunities with our partners. So exciting times for us all, but I'd now like to take the opportunity. Live on stage when we opened the innovation stage last year, what we felt was a power of partnerships, bringing everybody together, learning what it would be like if we got all of our suppliers in the room to work really closely, risk sharing, partnerships together. And I've got to say thank you. Vior have actually done that. So I would like to welcome to the stage Stuart Barclay to open our innovation stage. Thank you.
So the last thing you need, I hope you can all hear me, but the last thing you need is me, a Scotsman, standing up here talking about partnerships. So actually what we've done is we've brought one of our customers. We talk about partnerships. Alison, you did an amazing job last year, and your whole team did, talking about collaboration and partnerships. Thank you. Yes, we are achieving it. But let one of my customers tell you about it instead of me standing up here, because you'll be sick of me up here. But let me introduce, hopefully this works, let me introduce Natasha and Claire Aldridge.
My name's Natasha Corness and I'm the Tech Innovation Lead with Essex County Council. The goals for the project is to keep people as independent as possible, identify when they'd had a fall, and for us the opportunity to monitor people's daily activities over time allows us to intervene earlier. The dashboard allows us to have a real rich data set to really personalise care delivery for individuals. Vale gave us the opportunity to have a non-intrusive way of monitoring our customers across Essex and maintaining dignity and respect. It wasn't a camera that was monitoring them. You don't have to remember to put on a pendant alarm. We could start to really look at the AI and predictive side of things. So if we could start to see somebody was coming for a fall, then we could intervene earlier, and it really meets our ethos of prevention and early interventions, and to save more money down the line. I definitely would recommend VAR to other councils because we believe that it's technology of the future.
Come to the stage, Natasha Corness and Claire Aldridge from Millbrook in Essex.
So hi everyone, as per the video, my name's Natasha Corness and I'm the Tech Innovation Lead for Essex County Council. So how we kind of got around to finding VAR was from our Suffolk and North East Essex ICB board. We bid for some accelerator programme funding called the Unified Tech Fund. So this was for a funding pot for the Digital Social Care Fund. So it's a bit of a test and learn trial to inform and share our learning for people when it came to the Digital Social Care Fund. So we chose to look at the impact of falls and admissions to hospitals and reduce this by using sensor-based technology. We wanted to test across the wide variety of social care, so we looked across 4 different settings. One of those being in the community, so people in their own homes, but we also chose to look at sheltered accommodation, extra care housing, and also care homes in particular, which you saw in the video. So we've used this as a pilot, which would inform our future work across Essex for the 3-year digital tech funding. Across our 3 ICSs in Essex, we look to allocate 20% of the funding in year 2, so we're in the middle of writing those bids now, and also in year 3 of the Falls programme. So across Essex, we used our vulnerability matrix to identify hotspots of falls across Essex, and particularly across the north. So we went to our local frailty working group, which is run by the Alliance. We pitched the idea to them and asked who wanted to work with us. So you can see the variety of partners on the screen there who chose to come on board and see what this technology could do for them. So a working group was set up for tendering and culture to district councils, our voluntary sector who manage our hospital to home pathway, but also the North East Essex CCG at the time, because this funding was pre the ICB set up. So all of those shared their relevant falls data, which helped us to identify and inform who could be part of our pilot, and that's how we selected who would have the installs from VAR. So a true partnership approach was really critical for the success of this pilot and to get the best outcome to the individuals and the organisations involved.
Hi, I'm Claire Aldridge. I'm the Strategic Contract Manager for Millbrook Healthcare. So why did we select the VAR system? Well, we wanted a system that was going to help us detect falls that people didn't have to wear, because we know that a lot of people don't wear their falls devices. So we wanted something that anyone could use regardless of whether they'd remember to put it on or not. So the VAR system does that. It's non-wearable, it's non-intrusive. And also we wanted a partner to work with us who was going to provide a new technology which fit with our commitment to innovate and to continue to explore new technologies. We also wanted someone who was flexible and would work with some of our existing partners, and VAR do that, and they work with Anthropos, who we're already using on another project. So it was really vital to us to select a technology partner with an identified roadmap for future development. We didn't want to use somebody that was just going to sit still. We wanted someone who would work with us to develop the services we're offering. And that's why we wanted to do a test and learn across a range of different settings so we could really get the best data and look at getting the best outcomes and where we were getting the best outcomes in what settings. So that brings me nicely on to outcomes. So as I said, we wanted something that was very data-led, so we could use our data to support our health professionals to develop personalised care and also offer people more choice. And having this, particularly in our care home settings, allows the care professionals that are working with the individuals to tailor their care around the individuals by knowing more about what their typical behaviours are and what their typical activities are. So we're not using it just for falls prevention, we're also using it as a learning tool to learn more about that person and tailor the care around them. We do anticipate that there'll be some financial savings. Just for example, the care home that we're using it in, based on previous studies, we think we're going to be saving about 44k per annum just on avoidance of ambulance call-outs, hospital admissions, by being able to get to someone really quickly if a fall occurs. And that's so important that people aren't left on the floor for any length of time. So that's important to us, and it's important to the care home staff too. As I've said, the VIA is non-intrusive, there's no cameras, so it can detect people's behaviour without actually seeing them, so people like it and want to engage with it. And we also see it as a way of maximising the staff resource by learning more about the individuals and what their care needs are. We can tailor the resources we've got available to really meet the needs of the individuals. And I'm just going to leave you with some testimonies from some of the people that have been involved in this partnership. Thank you very much. I'll hand over to Stuart.
Thank you, ladies. No, absolutely amazing project, Natasha and Claire and their teams, I must say. It's not just about me and them, it's a whole team. Huge thank to Anthropos, huge thank to my team for delivering as well. And later on today, my colleague, my head of sales, is actually going to be talking about all the other partnerships that we've built throughout 2022 into 2023. And we actually sit on a panel session tomorrow with Paul Burney from Anthropos, talking about the outcomes, the client activity graphs, the trend analysis, and actually what we can do with the use of tech, but actually with the use of building a collaboration and partnership. That's a big thing for us. It's been great to see so many people here. It's absolutely amazing. I still think these headsets are the weirdest thing in the world, but thank you very much.
It's brilliant to see the developments there. So our project with Natasha, I've got to know them over the last 6-12 months because we've travelled the country. They won the Transformation Award here in ITEC in 2022. And what's really good about these programs is they're continuing to improve. They're continuing to find new partners. So well done. Now to talk about our partnership, the coalition is co-chair with Clinton in Tech Action Alliance. We can't just work within ourselves, the tech industry. We've got to look outside. We've got to be challenged in terms of our delivery, and we've got to be questioned on what those outcomes that we're trying to deliver. So I would like to hand over to this wonderful panel and my co-chair, Clinton Farquharson. Over to you, Clinton.
Thank you very much, Alison. Can everyone hear me? This is weird. Putting people at the heart of care and support is a loud and clear call for co-production. The quest for effective and equitable co-production. And it reminds me of the song by Arrested Development. I'm showing my age now. And it's called Let Your Voice Be Heard. And it's about voices and experience of people is baked into the challenge paper to deliver outcomes for people and providers. That's what the challenge paper is calling for. Currently, we talk about digitising social care, and health and housing, and re-engineering the system and processes. What I don't hear is about technology-enabled lives, and where the ambition and aspirations of individuals come first, made possible by digital. This challenge paper is a welcome opportunity to rethink technology-enabled lives and what people actually want from it. It's a chance to step back from equipment, solutions and systems to re-evaluate what matters most. What I mean when I think about my mobile phone and the apps enables me to live an ordinary life. I've got an app called My GP, and it enables me to take my blood pressure readings instead of going to my GP every 2 weeks. Instead, it puts me in control and my GP, and I send my readings every morning and every evening. And it enables me to live a life. It's a great way of seeing my records, my medication, and my prescriptions. That's what technology-enabled lives is about for me. And the challenge paper highlights the potential for greater use of technology to enable those of us who draw on care and support to live the lives we want. Thank you.
Thank you, Clinton. Oh, I've still got the things on. It's difficult when you sit down there and stand up. So thank you, Clinton. It's been inspirational having a co-chair like Clinton to keep us well and firmly rooted into people with lived experience and what difference it makes. I would like to welcome up now. Do you want to come up, David?
Do it from here.
Yeah. Sir David Pearson for our next reflections.
Okay.
Thank you.
Thank you very much. And good morning, everybody. And can the people at the back give me a thumbs up if you can hear me? That's wonderful. And well done to the people at the front, because you got here before all the seats got taken, because they're all standing up over there. They've been sitting here comfortably with coffees. So anyway, the good news about the headsets is also you can adjust them, so you can actually turn them off if you don't like what I'm saying. But obviously, on a serious note, these are turbulent times in terms of the current challenges we face. Sorry, I'm just losing my technology here. The current challenges we face, which are obviously quite profound. We heard from Paul Burstow this morning about the King's Fund evaluation through the surveys about the satisfaction rates with social care, and that people generally are struggling across health and care to receive the appropriate treatment, care and support that addresses people's needs in a timely way. And we've also got a situation where need and cost is rising beyond the capacity of services to always meet them in the way that we would all aspire to. We also know about the workforce challenges. So all those things need to be grappled with. They need national government, they need local government, they need suppliers, providers to work with them. But it seems to me that in the third decade of the 21st century, one of the things that we do have the opportunity to do is not just to have individual sections of technology that can do the sorts of things that Clinton talked about, but join up the various technologies in order to make the best benefit for the people and the system. So what do I mean by that? I think there are 4 things that I would mention. First of all, obviously, there is the passion that we are aware of around technology-enabled care and what it can do. And the importance of the document that's being launched today is that it provides a basis for a discussion, not only from people within in this conference, but out there in the wider system, the workforces, the leaders, the people who use services and their carers, in order to further promote what technology-enabled care can do. But there are three other components of good technology strategies in local integrated care systems. First of all, the best health and care organisations in the world bring together electronic records from across health and care to provide a better, more immediate response to people's needs. The bit about people not having to tell their story several times over, the ability to respond in real time by having access to those records. And when I led the integrated care system in Nottinghamshire, that made a huge difference to the timeliness of people's response across services. The second is to utilise the data from all of these various sources to understand where need is today. So help with prevention. Who needs prevention around their particular long-term condition that will help to maintain people's independence and choice and control for as long as possible. And also identify people in crisis today who need a response to stop something happening which is the next worst event in their lives, called population health and care management. And thirdly, we're also needing to join this up with the utilisation of medical devices which help people to manage their conditions. So whether it be a pacemaker or respiratory issues that we saw in the pandemic. So there are four things, it seems to me, that any integrated care system and suppliers need to think about joining up health and care in this country that would make quite a profound difference to the people whose lives need the support of health and care system. So, and I think so then the question is, what does that take? What would it mean if we were to put this into practice? Well, first of all, I think we would need to co-produce the solutions with people who use services and the army of unpaid carers, without whose contribution in this country, the National Audit Office predict we need to double the amount of money that's spent on health and care. So it's absolutely critical that this is co-designed. We need to build a coalition, because this isn't about pressing a button and it'll all happen. This is about conversations, building an alliance, building a coalition, which is just what the Tech Alliance was designed to do, about what the possibilities are. And the document helps with that, as well as the standards document that we're also publishing today. Each area will need a resource plan about how to put this into effect, and a workforce plan, because unless the workforce who are using the kit and the technology understand how to make that work best for people, and we have the technology specialists who understand what life is really like on the ground in terms of delivery of services, this won't work. And then we've got to set about changing the processes and the services in order to adapt to it. And of course, there's got to be a really sophisticated partnership between people who are commissioning services and people who are providing the technology, so that an intelligent and mature relationship and collaboration. And as the chair of Tech Quality, which has the only accredited quality service framework by UCAS in the UK, of course I'm going to say we need standards. We need to understand the quality and the safety and the effectiveness of it. And I see some nods around the room, but I think it does provide the assurance to people, both commissioning services and also those using them. And we need to make progress quickly. We need short-term projects that actually make a difference, so not waiting for the be-all and end-all. And then we've got to evaluate consistently to make sure that we know what we are delivering works. And finally, we've got to make sure that the technological barriers that could get in the way, we found a way through them in terms of interoperability and connecting services. So I'll leave it at that, and thank you very much, Alison.
Thank you, David. And now on to our next speaker. It's really important. You've heard on the main plenary how West Wales is working really closely with their health board. We were really fortunate, and I've worked with Tim for quite some time about how do we create this personalised preventative service model. So I was delighted when Tim Strawn supported the work of the TAC Action Alliance. So over to you, Tim.
Thank you, Alison. Again, sound check at the back, please, a wave. Fantastic. Yeah, so I'm absolutely thrilled to be here. It's a really critical launch today around a call for action because we are, as we've heard, in unprecedented times, unprecedented challenges. Certainly in my lifetime, we've never seen such a need for change. And actually carrying on as we are or going back to how we were is not an option, in my opinion. We have to move to a new normal. And we can't do that individually. The only way we can do that is collectively. And I think we'll hear a really strong theme around this collaboration and co-production, which for me, along with integration, are the three magic ingredients in terms of our approach around how we're going to solve some of these wicked problems. If we're going to make a big difference, I think we need to unite around a common set of problem statements, which have to be built around personalized outcomes. They have to start with what matters to people. So we've all got a massive role to play in this, in understanding what those key issues are, and then working together in lockstep to help to deliver those. And for me, there are three magic ingredients of how we make that happen. And certainly the technology is one of those, and it's great to see so much enthusiasm in that. But that cannot happen in isolation. There are two other critical ingredients you must have to achieve transformation. And we saw this in the pandemic when we saw some amazing change. It wasn't just about going virtual and tech. It was about doing things differently. So it's about a new process. It's about doing things differently. So we have to focus on new pathways, new approaches, new design, because actually just putting tech into the things that we already do isn't enough. We have to radically transform the way we deliver care. And that does go fundamentally into different settings, at home, closer to where people want to be. But the other key ingredient that we mustn't forget about, and has been referenced in this, are people. So not just people where the care is being delivered to and for, but actually the workforce, as we've heard. We need a new integrated workforce. And I think off the back of the work that we've heard from Claire Fuller, and the launch later this week of the work that Patricia Hewitt is about to announce, it is about a whole new integrated way of working, building on the integrated care systems, partnerships, boards, where we're actually creating teams of teams around the individual, using technology, but using new processes, new pathways. Thank you.
Thank you, Tim, and I'll come back with some questions on the how. So how do we do that? I would like our final speaker is the Director of Tech Action Alignments, Jeremy Hughes. Would you like to come? I know you've got some slides, Jeremy. Do you want to come up? Okay, go ahead.
At the back. Can you hear me? Yeah, good. So thank you for being here this morning, and thank you for the launch of this challenge paper. Just to recap from what Paul said on the stage earlier, the Tech Action Alliance is unique in that it's co-chaired by Alison from TSA and Clenton from Think Local Act Personal, but it's a coalition of over 30 organisations, and the unique thing is that it's across all sectors. So it includes care providers, commissioners, it includes representatives from government, from the NHS, and a range of tech companies and charities, and they're all working together, so nobody calls the shots. It's a level playing field where everyone has an equal say. And through the work of more than 30 organisations, we've produced the challenge paper that we're publishing today, and I look forward to hearing your comments as you read that. But just to give you a flavour of what's in there, the challenge paper consists of the perspectives that have drawn up from a whole load of consultation with people with lived experience who draw on health and care services. And we've drawn up their perspectives, we've included those in the paper, and a number of case studies of people with lived experience telling their own stories. We've done some quantitative surveys around what the public expect and shown that the public actually have an appetite for more use of technology than we currently make. And we've included, as Paul highlighted earlier, some exemplars from England, Scotland and Wales of where we know that we can make the difference, but those exemplars are still isolated. We end up in the report with a number of action points which I just wanted to highlight to you those action points that are in the report that you'll see at the end. Firstly, there's a set of action points for the tech industry itself. I do need to move actually. Do I need to be up there to move the slides on, or will they move anyway? So these are the action points that we've highlighted for the tech industry itself. Firstly, deliver the technology enabled that people want. Now, this isn't something that somebody else does. This is something, all these points are things we want you to do individually in your organization. The challenge is not the challenge to a third party, it's a challenge to all of us to take action during the course of this year. So you need to find out what people want, and we're co-publishing today a Getting Started with Co-Production guide, which is designed to get you on the first rung of the ladder of co-production. People often run scared of co-production. They think it sounds too difficult or too all-encompassing, that somehow it will get in the way of the business imperative of being a profitable organization that delivers care. What we demonstrate in the Getting Started guide is that actually it's not difficult, and it will be actually key to the success of you to be a thriving business. So please use that Getting Started guide to find out what people want. Secondly, make sure your services are coordinated and integrated at the local level. Not waiting for government to do it, the NHS to do it, the social care commissioners to do it. You can do it yourselves. Develop new models and collect the evidence. We have, as we've highlighted in the report, remarkably little evidence of what works. We know there are some great examples, and Stuart at the beginning in Essex highlighted one example, but we need more evidence. We need to collect that evidence, and we need to commit to integration and interoperability so that we can deliver in the most appropriate setting with the right flow of information and service provision. Workforce development we've already highlighted this morning. If the workforce don't embrace this, if they don't feel that the technology is to support them, the key myth is that somehow technology is there to replace the workforce. Actually, the answer is technology is there to enhance the quality of experience of the workforce, to enable you to do your job better, not to be replaced by technology. And certainly from my personal experience in my family and elsewhere, I know that nobody wants technology to replace the human touch of the care that they get from family caregivers and from professional care staff. But the technology, as highlighted earlier this morning, can give more time to that hands-on care. We want to make best use of data assets and ensure that what we use is fit for purpose. And finally, and probably most importantly of all, we have this new system of the integrated care partnerships and integrated care boards. We need to be in there talking about the role of technology. It's actually from the early work that we've seen of the output from those technology care boards, technology isn't talked about enough. There needs to be more conversations, more engagement about the future role of technology actually as the backbone of an awful lot of the way the system can work. If we can move on to the second slide, please, Alison. The second slide just takes you into some of the key areas that we're saying is appropriate for everybody as they use the Tech Action Alliance challenge paper going forward. So it doesn't matter if you're a tech provider, a commissioner, a voluntary organisation, a family, a government organisation. We want people to take these 6 points to heart. Firstly, the same point as I started on before, identify what people want. And as Rich said in his opening speech this morning, this is about enabling people to live the lives they want in the way they want, to be treated as individuals, to see the role of technology to empower and enable people to be treated as a person with a family, with friends, with aspirations, with desires to live well. Secondly, as I've already said for tech providers, collect evidence of market demand, collect evidence of what works, but also what people want, and the scale of which people want. As we've said and we've shown from the quantitative survey in the report, the public want more use of technology, and we're only scratching the surface. Thirdly, embed co-production. Co-production isn't a one-off. It's not something you do and you put back in the cupboard. It's about a continual cycle of engagement and involvement. And in your organization, not only do you need to engage in co-production the people who use your services and use the work as partners, but actually your own workforce have lived experience themselves, have expertise that they can draw on. Learn from barriers and solutions. We've highlighted in the report a number of the barriers that stop things happening at scale, but we've also identified the solution. Please look at those and learn from them, but add yours as well. The penultimate point is perhaps the most important, that we need an evaluation framework. We need a continual way of capturing this information and knowledge so that it becomes routine. It becomes part of the way in which we plan and budget going forward. Not a bolt-on extra addition, but the everyday life of providing care and support. And finally, help us over the course of the coming months to identify the policy and regulatory changes. Because whatever government we have in England, in Scotland, in Wales, in Northern Ireland going forward, those governments need us to be telling them what we want to see in the future of technology-enabled care. So just to end on the final slide, this is a call to action. This is saying we want you to all be part of the development of an action plan. The paper we're launching today is a challenge paper. As I said earlier, it's a challenge to all of us. It leads to an action plan at the end of the year, which is not just an action plan for us, but for government, for NHS, for care commissioners to work with us to deliver the answers for the long term. Thank you.
Thank you, Jeremy. We now just have about 20 minutes of Q&A. Has there anyone got a burning question, or will I pose some questions to our panel? Don't be frightened. Anyone? Okay. Clinton, we have a big job on our hands in terms of delivering what Rich Amos has asked of us. The paper is really clear about putting people at the heart of our transformation. So what do we intend to do in the Action Alliance to explore what people do want from technology? And I know we're going to have this meeting straight after here with our partners, but what do we need to do?
First off, from my point of view, is listen. And when I say listen not to reply, but listen to respond to what the person who's drawing on care wants. Because one of the things for co-production to really be embedded is to think about not waiting to get your ducks in a row. Start from where you are.
Thank you. Next question, David.
Hello.
You've made some powerful statements in the paper about the need for, there's a few, but one of your ambitions is to embed quality and safety. How are you, as Chair of Tech Quality, going to take that forward with our colleagues in the coming 12 months?
Yeah, I think one of the things about the quality service framework is that it's born out of taking cognizance of the best knowledge and information from the sector, from the technical side, but also from the service side, whether it be commissioners of services or suppliers. So we have something like 20 special interest groups that help develop the standards that go into the quality service framework. And when as for example this evening, there will be an event at 6:30 of giving out some of the certificates, that the stories that people who've been through the process tell me is how far it has improved their thinking about the services that they provide and the way in which it can be ready for future initiatives. So obviously many people we're all experiencing the move from analog systems to digital. We've all got the opportunities that are provided, which were described in the plenary session earlier about joining up the Internet of Things. But obviously that's got to be done safely and effectively. So it's also part of the evaluation, because regularly the point that Jerry made about evaluation is terribly important. If you talk to policymakers across the 4 nations and people like the Treasury, they need to be convinced by very hard evidence about what works. And sometimes we struggle to provide enough evidence about what works in the way that we've talked about earlier. So having that real-time evaluation and adjusting things so that they are responsive to the changing opportunities that we all have is so important as a bedrock of transformational change.
Thank you. In the audience, how many people are certified to the framework? Wow, great. So many more to work with. My next question, I think, is to Tim. Tim, we talk a lot about the formations in England of the integrated care partnerships and the integrated care boards. A lot of us out there, I'm assuming, are struggling to engage with what their plans are. How would you propose that we actually do that as a sector to make sure that our voice is heard?
It's a great question, and integrated care boards are still a relatively new thing. They were only created, I think, last July or earlier, less than 12 months ago, and they are writing and creating plans as we speak. We are going through quite a big transformation from the centre of trying to let go and empower local systems to determine what's most important for their local populations, and trying to devolve as much budget and money as we can down to them so they can use that money to best effect locally. I'm really encouraged that all of the ICSs, ICBs I talk to really want to understand the needs and wants of their local populations, and already have got, in many cases, quite sophisticated mechanisms of capturing those needs and wants. And I think it's really important that those local conversations are having in the spirit of that co-production. And so I would encourage all of you, within your respective systems, to reach out to those ICPs to make sure you are having those conversations, and they have got the forums to have those conversations, because that is so important.
Thank you, Tim. And I think my final question, Jeremy, would be, we've just talked about a coalition of willing parties coming together to work in collaboration. How does everybody in this room and the wider sector become involved in the activity of the Tech Action Alliance?
So very simply, let us know that you want to be involved. So you've got on the screen there the website. You can find a link that enables you to join in. It's all about devolved action across the whole sector to enable people in their part to play their part. And there are more people wanting to be involved now than ever before. I think the telling point from the point that Paul Burstow made this morning when he talked about the Nuffield King's Fund research that showed that 57% of people are dissatisfied with social care is that actually people are thinking about social care. It's not only that they're dissatisfied, but probably 5 years ago they would have said, what's that? It's nothing to do with me. We've got an opportunity, and we need to engage all those organisations, all those bodies. So sign up, get involved, take the paper, send us your comments, and participate in the work we do over the next 6 months.
Thank you, Jeremy. And sorry, but we have a gentleman just sitting outside there that has a question.
There I am. User myself. You can see that, and I need to say, because I need billion equipment from every service like NHS and council, because they do their BIT bit. What they do, but they do forget. If you need communication aid on your electric wheelchair service, they do get funny about that were about that because my communication aid, it isn't from wheelchair service. They don't like you to put anything on their wheelchairs like they don't think heavy equipment is important for that person. How can we change that culture? Hello there, I am using myself in the currency and I need to safety cars I need to and getting from every service like NHS and currency because they do what they do for if you need communication aid on your electric wheelchair service. They do get funny about this because my communication aid is from wheelchair service. They don't like you to put anything on their wheelchairs like they don't think heavy equipment is important for that person. How can we change that culture?
What's your name?
I am P E T Peter.
Peter, thank you so much, Peter, for sharing that with us. I think that just demonstrates exactly the work that we've been doing in the sector for some time, championing co-production with Clinton and TLAB. You're just everything that we need to think differently about how we deliver care. Is there anybody on the panel that would like to respond to Peter about how we can change this dial?
I was just going to give an example, Peter, from my own experience, because what you said really resonated to me. Many years ago, I was the Director of Public Affairs for Leonard Cheshire, the disability charity, and we ran a campaign working with the muscular dystrophy group to get powered wheelchairs for people who had muscular dystrophy, because there was no provision of powered wheelchairs. And to begin with, the government said you could have a powered wheelchair, but only if you didn't use it outside of your own home, which was an absurdity. But we took 2 years of campaigning, but because we campaigned, we got there in the end. And that's always filled me with hope that actually, if you do campaign, if you keep banging on about it, you can get the difference. And I'm just speaking personally, I think about the cost of being in a hospital bed for a day, and it's something like £450. Now, if everybody who calls on care and health services is given £450 in order to change the way their service is provided, I think we could deliver an awful lot of difference. So that's just a personal view. But let's think about how we use the money that's already there to actually enable people to get what they really want, rather than what the system thinks they ought to want.
David?
Peter, thank you very much for your point, your question. I think, one of the things that's been quite important in social care over the last 50 years is the personal budget movement, which is about trying to bring the money around people's needs. Now, clearly, we've still got further to go. So that's the first point. So actually making personalisation really count and putting people in control is terribly important. The second thing is, it goes back to what I was saying about joining up bits of the system around people's needs so that you don't get the silo or the wheelchairs, the communication aids, and you're left trying to put the pieces together. I see you're nodding. So I think that's so important. And it also goes to the heart of the quality standards that I mentioned, because actually our quality standards, accreditation are about, is this proactive, is this preventative, is it giving people choice and control, rather than giving out bits of kit that actually, unless they're joined up, don't make a real difference to people's lives. So again, thank you for your point. And also, can I say thank you very much for raising a question, because I think it's very good to get it from the floor so that we can have a dialogue. That's how we learn together.
We'd certainly like to speak to you, Peter. We're going to create a network of really the first piece of work that we need to do is do exactly what you're saying. So Jeremy or I will come over and see how we can connect with you. And I think just reflecting, it feels very hard to do. We co-designed our 3-year business plan. And when we went through the process of taking our business plan through our board of directors, our members, people who, deliver services, when we spoke to the people with lived experience, it was like they had threw it up in the air, then made it land in a place that was going to make a difference. So I feel really proud that TSA has done what it says on the tin. We need to embed co-production in all of our governance and everything we do with our sector. Now, if we can do it, we need to encourage everyone else to do it. It is an enlightening experience when you actually go through the process. In TAPI, the program that you're going to see next on this stage, co-production is at the heart of that work program. Co-producing with people who live in housing, being part of procurement to buy the technology, live people, tenants are all in that process. So we just need to think differently about what we really mean. So Peter, you are magic, and thank you for being here in the opening of the innovation, because I think what we all need to think about over the next 2 days is keep thinking about Rich, thinking about the wise words of Clinton, and thinking about what Peter, all different scenarios about how they live a good life. So I'm going to ask our panelists for one takeaway. They've got 2 days to go out there and be insightful. What one takeaway do you want to leave from the panel today, David?
Okay, so what change takes generally is not a bunch of technical experts or supposedly important people, but it takes a movement of people who get the vision and can take it forward. So actually, what I would encourage people to do is to read the paper that we produce and think that if we can each convince and talk to 10 people who don't know much about it, and they each talk to 10 people, we've very quickly got a movement, and we've got something that really changes the offer to the people of this country. So I think the opportunity is immense, and I would encourage you to be part of that journey and that movement.
Thank you. Tim?
Yeah, thank you. I'd like to highlight the point around evidence and evaluation, which is really key in the report we'll see later on. For me, if we're really serious about personalised outcomes, we need to ask people, we need reported outcomes from patients. So I'd encourage all of you, whatever you're doing, ask the question, record it, codify it so it's data, and that will become really strong evidence as we build the story.
Thank you, Tim. Jeremy?
I think for me, the key is to identify a small action that you can take and deliver within a couple of months and then shout about it. Because if we all think about it as a big change, we'll never get there. So something you can do, you can deliver, you can then talk to your team and the wider community and then build on that.
And from my co-chair?
Hopefully, I would like you to think differently about the role of technology-enabled lives. What does that actually mean to you in the role that you do to enable people like myself, Peter, and Rich earlier this morning to live an ordinary life?
Thank you. And for me, I would like you to continue. Everybody in the tech-enabled care sector is passionate. they're resilient, they keep going. It's difficult, but we really did position ourselves in COVID. We're positioning ourselves now. You're going to hear some fabulous joint work in the integrated care system in Warrington, and we're resilient. Keep doing that and keep defying that the norm and the current system is what we want, because we don't. So please engage with the Tech Action Alliance. Let me know, or engage as you do as a member of TSA. If you're not engaging, come and see the team. So thank you. I think there's lunch going on there. I can smell it. So go over and have your lunch and join us back in plenary. Brilliant. Thank you.